Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about disorder of the upper respiratory tract. Infectious and inflammatory disorders. Inflammation of the upper respiratory tract can be caused by inhaling irritant such as cigarette smoke or air pollutants, but is commonly due to infections. Such infections are usually caused by viruses that lower the resistance of respiratory tract to other infections. This allows bacteria to invade the tissues. Such infections are only life-threatening if they spread to the lungs or other organs, or if inflammatory swelling and exudate block the airways. Pathogens are usually spread by droplets infection, that is, tiny droplets containing pathogenic materials suspended in the air, in dust, or by contaminated equipment and dressings. If not completely resolved, acute infections may become chronic. Viral infections cause acute inflammation of the mucous membrane, leading to tissue congestion and profuse exudate of watery fluids. Secondary bacterial infection is particularly likely in vulnerable people such as children and older adults. Viral infections are most dangerous in infant, young children, and the elderly. Common cold and influenza. The common cold, coryza, is usually caused by the rhinoviruses and is a highly infectious, normally mild illness characterized mainly by runny nose, sneezing, sore throat, and sometimes slight fever. Sinusitis. This is usually caused by spread of microbes from the nose and pharynx to the mucous membrane lining the paranasal sinus. The primary viral infection is usually followed by bacterial infections. Tonsillitis. Viruses and Staphylococcus pyogens are common causes of inflammation of the palatine tonsils, palatine arches, and walls of the pharynx. Severe infections may lead to suppurations and abscess formation. Occasionally, the infection spread into the neck, causing cellulitis. Following acute tonsillitis, swelling subsides and the tonsil returns to normal, but repeated infections may lead to chronic inflammation. Diphtheria. This is a bacterial infection of the pharynx which may extend to the nasopharynx and trachea, caused by Corynebacterium diphtheriae. A thick fibrous membrane forms over the area of any area and may obstruct the airway. Hay fever, allergic rhinitis. In these conditions, atopic, that is immediate hypersensitivity, develops to foreign proteins, antigens, example, pollen, mites in pillow feathers, animal dander. The acute, the acute inflammation of nasal mucosa and conjunctiva causes rhinorrhea, that is excessive watery exudate from the nose, redness of the eyes, and excessive tear production. Now we'll discuss further detail about disorder of the upper respiratory tract. Disorder of the upper respiratory tract affect the nose, throat, and voice box and include conditions like the common cold, sinusitis, and croup, while the lungs are affected by lower respiratory disorders such as pneumonia, bronchitis, and COPD. The upper respiratory tracts The upper respiratory tracts include the nose, mouth, throat, that is pharynx, and voice box, larynx, and it is lined with a mucous membrane to trap irritants. Upper respiratory tracts. There are infections or conditions affecting the passage of the nose, mouth, pharynx, and larynx. Common cold, a viral infection of the upper respiratory tract. The common cold is a contagious, mild viral infections of the upper respiratory tract, mainly affecting the nose and throat, caused by over 200 different viruses, with rhinoviruses being the most frequent. Symptoms include the runny nose, sore throat, and cough, with treatment focusing on rest, fluids, and managing symptoms rather than a cure. Colds are most common in fall and winter but can occur anytime, spreading easily through respiratory droplets and contact with contaminated surfaces. Sinusitis, inflammation of the nose. Sinusitis is a condition characterized by the swelling and inflammation of the mucous membranes lining the sinuses, with which are in filled cavities in the bones of the face. This inflammation can be caused by viruses, bacteria, fungi, and allergies, and can result in symptoms like thick nasal mucus, nasal congestion, facial pain, and pressure, loss of smell, and fever. Sinusitis can be acute, short term, lasting up to 4 weeks, or chronic, long term, lasting 12 weeks or more. And treatments focus on relieving symptoms and reducing inflammation. Tonsillitis. Tonsillitis is the inflammation and swelling of the tonsils, typically caused by virus or bacteria, leading to symptoms like a sore throat, fever, and difficulties swallowing. Treatment varies by cause, with risk and symptoms, relief of viral infections, and antibiotics for bacterial infectious like strep throat. Diagnosis involves a doctor examining the throat and may include a swab test, and surgery is usually reserved for recurrent case or complications. Pharyngitis. Pharyngitis. Inflammation or infections of the pharynx or throat. Epiglottitis, inflammation of the epiglottis, a flap of tissues at the base of the tongue. Laryngotracheitis, a condition affecting the larynx, voice box, and trachea, that is windpipe. Croup, a respiratory infections common in young children under 5, related to the lungs and lower respiratory tract. Disorders affecting the lungs and themselves include pneumonia and infections that causes fluid buildup in the lung. Pneumonia is an infection that causes the lungs air sacs, alveoli, to fill with the fluid or pus, leading to inflammation and difficulty breathing. It is typically caused by bacteria, virus, or fungi. Some symptoms vary but often include a cough, fever, chills for bacterial pneumonia, and supportive care for most viral cases. High risk groups include young children, older adults, 65 plus, and people with weakened immune system or chronic health conditions. Bronchitis, inflammation of the airways, bronchi. Bronchitis is a condition where the airways, that is bronchi in the lungs, become inflamed and irritated, leading to a cough, sometimes with mucus, wheezing, and shortness of breath. It can be acute, a short-term infections, or chronic, long-term conditions, usually caused by smoking or air pollution. Common symptoms include a hacking cough, producing mucus, fatigue, and headache. COPD, chronic obstructive pulmonary disease, a progressive, irreversible breathing disorder. Asthma, a chronic condition that causes airway inflammation and narrowing. Asthma is a chronic lung disease where the airways become inflamed and narrow, causing symptoms like coughing, wheezing, chest tightness, and shortness of breath. It's a long-term condition that involves airway inflammation and muscle tightening around the airways. While genetics and environment play a role in who develops asthma, common triggers like allergens, irritants, and respiratory infections can cause symptoms to worsen, leading to an asthma attack or flare up. Asthma can be managed with proper treatment and by avoiding known triggers, but it occurs working with a healthcare professional to create a management plan. Lung cancer, cancer that starts in the lung. Lung cancer is a serious disease where cells in the lungs grow uncontrollably, forming tumors and damaging healthy tissues, often due to smoking or inhaling toxic chemicals. It is a leading cause of cancer death globally, with major types including non-small cell lung cancer, that is NSCLC, and small cell lung cancer, SCLC. Symptoms can include a persistent cough, chest pain, and shortness of breath. Treatment options such as surgery, chemotherapy, and radiotherapy depend on the type and stage of the cancer. Tuberculosis, an infection disease that primarily affects the lung. Tuberculosis, TB, is an airborne bacterial infections primarily affecting the lungs that spreads when a person with active TB cough, sneeze, or spits, releasing infectious droplets into the air. While most people are infected with the bacteria don't develop symptoms latent TB, a significant portion will progress to active TB diseases, which is curable with antibiotics but can be fatal if untreated. Common symptoms of active TB include prolonged cough, chest pain, fever, night sweats, and weight loss. COVID 19. COVID 19 is a respiratory illness caused by the SARS-CoV-2 virus that primarily affects the upper respiratory tract, leading to symptoms such as fever, cough, and loss of smell or taste. While it often manifests as an upper respiratory tract infections, its symptoms can be similar to other respiratory illness like influenza, making differential diagnosis challenging, especially in children. So far, we discussed about human anatomy and physiology, about lungs, disorder of the upper respiratory tract. If you have done, please subscribe our YouTube channel.